Apurva Chandra, the Secretary of Ministry of Health and Family Welfare, has just returned from the 77th World Health Assembly in Geneva, where he served as the chair of committee. In presenting his report on the committee's work over the past 6 days, he emphasized on the Assembly's intense agenda and the rich discussions that led to pivotal decisions shaping the future of global health. DD India's correspondent Siddharth Bhardwaj had the opportunity to speak with him in an exclusive interview. Let's listen in.
India played a crucial role in helping other countries agree to the adoption of International Health Regulations 2005 held at the 77th World Health Assembly in Geneva a few days back to protect against future pandemics. Now to know more about this, I have with me India's Health Secretary, Mr. Apurva Chandra. Sir, thank you so much for joining in. Tell us about the outcomes of the 77th World Health Assembly and especially which are of relevance to India.
Actually, in this World Health Assembly, there were two major treaties which were being looked at. One is the amendment to the International Health Regulations 2005 and second was the Pandemic Treaty. The Pandemic Treaty is again which has been proposed post the pandemic, then how the vaccines will be given, how the pathogens will be accessed. So that is part of the Pandemic Treaty, and both these regulations are under discussion for over 2 years now. In fact, in the last 4 months also, many of our delegations went and they were part of these discussions throughout, and not much conclusion has been reached. Even on the 25th, just before the start of the World Health Assembly, also these were discussed. Now, what happened was that what happens is that these two treaties are being discussed separately. The IHR was being discussed separately, and the Pandemic Treaty was being discussed separately. And both the groups, because there were some commonalities, and then one group would say something, pass it on to the other, then the other will pass it on to this one, and a common decision was not getting reached. So in this, as a chair of Committee A, I proposed on the first day itself, that is on 27th, and we floated a white paper on the 28th, which was the next day, that there should be one common drafting group for both the treaties. And I think that was of a great help, because then the two groups came together, the countries, all the representatives which were basically going in two different groups, they came together. And at least they were able, over the next 3 days, a lot of midnight oil was burnt. Even our Indian delegation, they all participated, they were part of that. And on all the 3 days, I think meetings went on till 11 o'clock, 12 o'clock, and on one day, in fact, it went on till 2 a.m. in the morning. But finally, on the last day, that is on Saturday, that is the 27th, that is on the 1st, the final agreement was reached at 11 p.m. in the night. And when the meeting was to conclude at 12 midnight, 11 p.m., we were finally able to conclude the IHR. And that was largely because these two groups came together.
Okay. Sir, what role has India played in ensuring that the world comes together to address a global health challenge?
See, the major issues there were from the African Union, because they are largely the recipients of any vaccines, and then the European and US. And India, of course, plays the mediatory role, because we are on both the sides in terms of that we are major producers of vaccines also. We have helped so many countries during the pandemic period, and we also understand what the low-income countries, we represent the global south. And while the global north also respects us, because we are major producers and we are on both the sides, so we play a large mediatory role in this.
Definitely. Sir, the entire world knows about the COVID-19 pandemic, and that was the time which was really hard for everyone. We also saw the response when it comes to addressing the health issues of people. So I want to ask you, sir, is the world ready for another pandemic?
This IHR, I think, is a step ahead, because it shows that 194 countries can come together. They can work on a common platform, and they can erase their differences and arrive at a common agreement. So I think this IHR is a big step. Now in this particular WHA, because the time was short, the INB could not be finalized, the pandemic treaty could not be finalized, and another 1 year timeline has been given. Optimistically speaking, people are saying that maybe they will target December. But that is a treaty which, again, people are looking forward to, and we hope that all the countries will, like in the IHR, they will come together at least in the next World Health Assembly, that is the 78th World Health Assembly, that treaty would also be signed.
Definitely, sir. Climate change, pollution, these things, amongst the other things, are having a negative impact on human health. So, how was this issue taken up at the Assembly?
The Committee A, the remit of Committee A was all these issues were discussed in Committee A, and they were long discussions because all the countries mentioned their own concerns about that. And finally, in this Committee A, which I was chairing, there were 9 resolutions which were passed, and all these issues were covered. There were a lot of discussion, but finally everything was arrived at a consensus. And another major decision in the Committee A was that the program of action of WHO for 2025-28, which is the first program of action after the pandemic. So that 4-year program was also discussed and passed. So that will set the agenda of WHO for the next 4 years.
Up next, we turn focus to sport.